For Part 2, we'll discuss how airborne transmission can be controlled. We'd like to thank the following institutions and individuals. In this section, we'll delve into the importance of respiratory protection. Some of the slides in this presentation are very detailed, and you are welcome to pause the recording at any time to review the slides in more depth. We hope that by the end of this module, you'll be able to define the hierarchy of controls, list examples of administrative controls and engineering controls to reduce airborne hazards, and explain the difference between a face mask and a filtering facepiece respirator. Let's take a moment to review the difference between personal protective equipment, or PPE, and airborne and droplet exposures. In airborne protection, respiratory protection is added on to droplet protection by changing the face mask to be an N95 respirator or greater. Cloth masks help reduce the spread of droplets from the user to others. Wearing cloth mask coverings in public settings, in addition to social distancing measures, can help prevent community spread of infectious diseases. Because the face masks reduce droplets coming from the user, they can be useful for patients to wear during triage or transportation, as long as the patient is comfortable. For people who may have difficulty remaining 6 feet apart at all times, face shields or other eye protection is needed. These droplet prevention measures are helpful when the likelihood of exposure is low, such as during brief interactions with members of the public, but do not provide protection from airborne hazards. The hierarchy of hazard controls is a system to eliminate or minimize exposure to hazards. The controls are ranked here by how effective they are from elimination, the most effective, to PPE, the least effective. In situations such as the COVID-19 pandemic, elimination is not possible until a successful vaccine is made available. Substitution is not possible for a biological hazard that is in the community. This leaves us with engineering controls, or isolating people from the hazard, administrative controls, or changing the ways people work, and lastly, protecting the worker with personal protective equipment. Engineering controls protect workers by reducing hazards, or by placing a barrier between the worker and the hazard. Here are some examples of engineering controls. An example of an engineering control is the creation of negative and positive pressure rooms. Positive pressure rooms maintain a higher pressure inside the room than outside of it. This means that air can leave the room without circulating back in. Germs, particles, and other potential contaminants in the surrounding environment will not enter the room. This is helpful for immunocompromised patients. In contrast, a negative pressure room uses lower air pressure to allow outside air into the room. This keeps potentially harmful particles within the negative pressure room. Negative pressure rooms in medical facilities isolate patients with infectious conditions and protect people outside the room from exposure. Ventilated headboards are an engineering control that work to capture airborne aerosols before they have a chance to disperse. This protects the air and surrounding surfaces from contamination. It also protects personnel from the hot zone of infectious aerosols, while its open front allows patient access. A link to a guide for creating ventilated headboards is provided at the end of the presentation. Let's switch gears to administrative controls, which are changes to the way people work. Administrative controls do not remove hazards, but limit or prevent people's exposure to hazards. Examples of administrative controls include procedure changes, employee training, and installation of signs and warning labels. Examples are provided here. Environmental cleaning of healthcare facilities refers to cleaning floors, walls, medical equipment, furniture, and accessories which may come in direct or indirect contact with patients. Here are some general cleaning principles. The recommendations for cleaning frequency, as illustrated by the guidelines from the Ministry of Health of Liberia, are illustrated here. The frequency of cleaning surfaces in a particular area or department depends on how frequently or infrequently they are touched and the amount of body fluid contaminating the surfaces. Frequently touched surfaces, or high-touch areas such as tables, countertops, IV poles, beds, chairs, and floors, should be cleaned at least twice a day and when visibly soiled. Infrequently touched or low-touch areas, such as walls and ceilings, should be cleaned once a day and when visibly soiled. The cleaning frequency also depends on the type of activity taking place in the area and the risk of infection associated with it. Screening areas and toilets should be cleaned at least twice a day, and after use by a patient with a suspected infectious disease. Isolation rooms and inpatient areas should be cleaned twice daily and after each patient discharge. Personal protective equipment is lowest on the hierarchy because it relies on each person to use correctly, may be uncomfortable or challenging to use, and may be less effective. However, it is often necessary. So, what PPE is needed? Selection of appropriate PPE depends on how the agent is transmitted, how severe the disease is, and what the healthcare worker can tolerate. It includes gloves, respirators or masks, and eye protection in the form of goggles or a face shield. It's important to consider whether droplet or airborne protection is necessary. You'll want to think about what is available, as well as the likelihood and intensity of exposure. Eye protection is important under many circumstances, but especially to prevent droplet transmission. It can also help keep workers safe from chemical splashes. Challenges can include heat and fogging, and some healthcare workers may need to use protection over their prescription eyeglasses. Respiratory hygiene is a set of measures to minimize droplet or airborne transmission of pathogens. These measures include having patients wear masks if they can tolerate them. Patients, healthcare workers, and visitors should cover their nose and mouth with a tissue or mask when sneezing or coughing, and wash their hands afterwards. When attending to patients with respiratory symptoms, healthcare workers should always wear goggles or a face shield. Surgical masks may reduce exposure to droplets, but are ineffective for stopping aerosols or airborne particles because they fit the face loosely and the airborne particles race around the sides of the mask and are breathed in. Respirators are a type of PPE used to protect workers against breathing airborne hazards and are often used with other types of PPE. Respirators have their limitations and are not a substitute for effective engineering and work practice controls. When it's not possible to use these controls to reduce airborne contaminants, respirator use may be the best way, or the only way, to reduce worker exposure. Healthcare workers using respirators must be trained, medically evaluated, and fit tested. The main value of the respirator is the face seal, which prevents infectious particles from entering through the sides. Filtering facepiece respirators are designed to reduce inhalation exposure to particulate contaminants. They include N95 respirators and elastomeric respirators. Both of these respirators require fit testing, which tests the seal between the respirator and the face. This seal is why beards are not compatible with these types of respirators. Eye protection is also needed when using either of these respirators. A major difference is that the elastomeric respirator is designed to be reusable and requires cleaning protocols for reuse. Elastomeric respirators come in half-face or the more protective full-face styles. Elastomeric respirators are tight-fitting respirators made of synthetic or rubber material. They can be half-face or full-face. Experts agree that elastomeric respirators provide better protection than N95s, although they increase the work of breathing to a greater extent and may be less comfortable. They can be repeatedly cleaned, disinfected, and reused. For healthcare workers, elastomeric respirators should be used with filters that are in covered cartridges. The exterior of these cartridges can be cleaned. Particulate filter cartridges are replaceable components of elastomeric respirators. There are different types of particulate filters, but all certified filters scrub out over 95% of microscopic particles. Filters labeled with the letter P are oil-proof. Those labeled with the letter R are oil-resistant, and those labeled with the letter N are not oil-resistant. For healthcare workers, oil is not actually an issue, and pathogens are effectively removed by all filters. Filters used by healthcare workers must be inside a cartridge that can be wiped down for cleaning, so that they can be reused. Note that filters cannot be wet. They need to be removed before the respirators are cleaned. If recharging capability is not a problem, the most comfortable and protective respirators are powered air purifying respirators, known as PAPRs. The air is filtered through a belt pack and fed through a hose to the hood. These do not need to be fitted, and the user can have a beard. They do not increase the work of breathing, although they might cause noise or visual limitations. They are also very expensive, but can be purchased with a reusable hood and can be used over and over again. To wrap things up, let's review a brief summary of key concepts. First, the hierarchy of hazard controls is a system to minimize or eliminate exposure to hazards. Engineering controls protect workers by reducing hazards, or by placing a barrier between the hazard and the worker. Administrative controls are changes to the way people work. Examples of administrative controls include procedure changes and employee training. Face masks reduce the spread of droplets from the user to others. Face masks do not provide protection from airborne hazards. In contrast, filtering facepiece respirators reduce user exposure to airborne particulates. Here are some additional resources.